This is a video from the topic B5, homeostasis and response, looking at some higher only content, so still double and triple, but only if you're taking higher tier content, looking at hormones to treat infertility. Now, it might be that for whatever reason, a woman is not producing enough FSH. So it could be that she goes to a fertility clinic, they give her some injections of FSH, she's able to mature eggs, and then she becomes pregnant, and that's all the intervention that she needs. It could be that she's maturing eggs, but they are getting stuck, kind of trapped in the ovaries because she's not releasing the LH to release the egg. So it could be that she has some LH and it releases an egg, she becomes pregnant, and that's the only intervention she needs. Fertility treatment in fertility clinics can then go on to IVF, in vitro fertilization, and this is where the egg and the sperm are fertilized outside of the body. So this would happen in a petri dish, and there would be first of all injections of FSH to mature as many eggs as possible. And then the woman would have some of those eggs removed, maybe 20 eggs removed, so quite a lot to increase the chances of success. The eggs would then be fertilised by the sperm in the lab, so in the petri dish, and then it would be a case of watching those under a microscope to see which ones are developing successfully into embryos, and then one, possibly two embryos are inserted into the mother's uterus. This situation would be used if maybe the man had a low sperm count or if the woman had damaged oviducts, okay? And it could be the case that she's had what we call an ectopic pregnancy, where there's ciliated cells in the ovaries, in the oviducts that move the egg from the ovaries to the uterus. And if those ciliated cells aren't working properly, the egg doesn't move down to the uterus. And so if it's been fertilized in the oviduct and then it starts to mature there and starts to grow into an embryo, it can actually cause the oviduct to burst. And if that's happened in both oviducts, which is possible, then the woman can't actually have children unless she uses IVF. Okay, so that's one of the more extreme situations that would result in using IVF. Let's have a look at some of the drawbacks of IVF. It's very stressful emotionally and physically to think that every month you're trying to become pregnant and it might not happen. The build up to it, time and time again, having kind of negative responses to it, not becoming pregnant. You can see how it could take over your whole world, really. The success rates are really, really low. Okay, so it really is a difficult method to use, but if it's the only method that you've got available to you, then obviously you're going to try it. And quite often we see questions that say, why is it bad for multiple births? Please don't say anything about population growth or anything like that. You have to just say that it's risky for the mother and the baby. There is a greater chance of miscarriage by having multiple births. So you could think, oh, it's a good idea, we're putting 2, 3, 4 embryos. They wouldn't do that, because that extra, if you had more than one embryo growing inside the mother, it is more risky. There's more likely a chance that you could have a miscarriage. Hope you found that useful. Thank you.